Hello viewers, so in this video I will discuss briefly about the respiratory tract infection, like what is respiratory tracts and what is included in the respiratory tract infection. Like there are so many diseases involved in the respiratory tract infection. Like example, bronchitis, pneumonia, coronaviruses, Otitis media, pharyngitis, rhinitis, all are included in the respiratory tract infection. So at first we have to know about the respiratory tract. What is respiratory tracts? So here you can look. This is called upper respiratory tract. Here you can see upper respiratory tract. So this is called sinus. Here this is nasal cavity, nostril, this one. Here in the lower side, this one is larynx, trachea, esophagus, pharynx, this one is tonsil, and here under the mouth, here located and portion, it's called alveoli. So this is called upper respiratory tract. Now we will move to the lower respiratory tract. Here is the picture of lower respiratory tracts. This one is called larynx, and here the under the larynx, it's located under the larynx. This is called trachea. This one is left superior lobe of lungs. Here left inferior lobe, and move to this side, right superior lobe, then right primary bronchus. Here you can see right primary bronchus, then secondary bronchus, tertiary bronchus, and then terminal bronchus. Terminal bronchus means where the bronchioles has been ended of the lungs. Right inferior lobe, and here you can see left inferior lobe. Right middle lobe, here you can see the right middle lobe. In right inferior lobe, here is the microscopic zoom of right inferior lobe. Respiratory bronchiole, alveolar duct, alveolar. Here you see the respiratory tracts. Now we will move to the different type of respiratory tract infection. So we will briefly discuss about the various types of respiratory tract infection. Respiratory tract infection. Here you can see respiratory tract infection refer to any number of infectious disease involved in the respiratory tract. Like any infection, if an infection attack on in the respiratory tracts, then it's called respiratory tract infection. Mainly, it is classified into two types. They are upper respiratory tracts and the lower respiratory tracts. About upper respiratory tract infection. Upper respiratory tract infection URI or URTI upper respiratory tract infection are the illness caused by acute infection which involve in the upper respiratory tracts. That means any acute infection if attack in the upper respiratory tracts, then the place where the infection taking place, that is nose, sinus, pharynx or larynx. These commonly included tonsillitis, pharyngitis, laryngitis, sinusitis, otitis media and the common cold. These are the place where the infection taking place, and we call those places in this name. Then we will move to the pathophysiology of the respiratory tract infection. So the pathophysiology is bacteria have been found in more than 90% cases in Otitis media. So more than 90% bacteria are Otitis media bacteria. Commonly bacterial pathogen included Streptococcus pneumonia, Haemophilus influenza and Moraxella catacularis. Acute otitis media usually follow a viral respiratory tract infection that impairs with the mucociliary apparatus and cause Eustachian tube dysfunction to middle layer. So this otitis media blockage the functioning of the Eustachian tube. So the Eustachian tube will not be functioning well if the otitis media attack in the respiratory tracts. Now we will see the sign and symptoms of the streptococcal pharyngitis, like the symptoms is sore throat, pain on swelling. If any place is like get bowel, then there you can feel the pain. The person suffer with fever and headache, nausea. Nausea means before the vomiting time, feeling of regurgitation, like vomiting will be taking place in this man or in the person. or if vomiting and pain in abdomen, red cell in evil. So the diagnosis test for the respiratory tract infection is rapid antigen detection test RADT. Then we will move to the symptoms of acute bronchial rhinitis. The symptoms of the acute rhinitis is pleural anterior and nasal discharge, discolor posterior nasal discharge, facial pain or pressure, and also fever can be taking place, headache, ear pain and dental pain also you can see on the attack of bacterial rhinitis. Now we will move to the lower respiratory tract infection. It is divided mainly in the bronchitis and pneumonia. So bronchitis is also divided into two types, acute bronchitis and the second one is chronic bronchitis. So what is acute bronchitis? Acute bronchitis is characterized by inflammation of the epithelium of the large airway for infection or exposure to the irritating environment. Mainly acute bronchitis is for short time but it is very infective. It can damage very big way. So here the inflammation taking place in the epithelium and it can be occurs if the person exposed to the irritating environment like the air pollution and cigarette smoking place, where the pollutant area and any person is cigarette taking or smoking cigarette, that places that person can suffer to the acute bronchitis. The most commonly infected agent are influenza AB, parainfluenza viruses and adenoviruses. So here you can see the acute bronchitis causes the infection are influenza AB, parainfluenza viruses and adenoviruses. Now we will move to the chronic bronchitis. What is chronic bronchitis? Chronic bronchitis is a result of several contributional factors. So chronic bronchitis is taking place together with lots of things, the lots of factors. The factor is like including cigarette smoking. Cigarette smoking is one of the most dangerous factor for chronic bronchitis. Then second one is exposure to occupational dust, like if any person working in a chemical industry or dust industry or pollutant industry, then the person can be suffer with or attack with chronic bronchitis. Then fume means the smell of the bad smell, like in smoking industry smell, cigarette smoking smell, and many chemical smell and environmental pollution, like that kind of pollution taking place in our environment in daily basis. Like nowadays everyone is cut tree for the money and the environment is polluted. The carbon dioxide level is increased and oxygen level is decreased. So this way our environment is polluted and so the chronic bronchitis is taking place to that place, especially this kind of bronchitis taking place in urban area like city and host factor like genetic factor. Now we can see chronic bronchitis is a clinically defined as a presence of chronic cough productivity. Like here on symptoms of chronic bronchitis is cough taking place to that person from lots of time and sputum lasting more than 3 consecutive months of the year, and the itching lasting to this man like more than 3 months to more than 1 year or 2 year maybe. The sign and symptoms of the chronic bronchitis is the person will feel restlessness and mild fever and cough. Also the symptoms of the chronic bronchitis and even vomiting, diarrhea, nausea, breathing, all are the symptoms of chronic bronchitis. Physical examination: tachycardia, respiratory rate 40 to 80 beats per minute. And the second one is mild conjunctivitis in 1/3 patients. Conjunctivitis means the infected person eyes will become redness, or it can be taking place on third person, like if 3 person is getting attacked in the chronic bronchitis, one of that person will be suffer with mild conjunctivitis. That means within 3%, 1% eyes will become red. The laboratory test for the chronic bronchitis is abnormal anterior blood gases and peripheral white blood cell count. So the peripheral white blood cell count is one diagnostic test for chronic bronchitis, and the another one is abnormal anterior blood gases. Then we will move to the another disease of lower respiratory tracts, that's called pneumonia. Pneumonia remains one of the most common causes of severe septic infection, cause of death in children and adults with a mortality rate of 30 to 40%. So pneumonia is the one of the dangerous respiratory tract infection that can cause death to the children and adults of total respiratory tract infections 30 to 40%. That means 30 to 40% of the rural respiratory tract infected people death by the pneumonia disease. The sign and symptoms of the pneumonia is fever, chills, dyspnea, and productive cough. If the person suffers with fever, and the person is produce crop productively more than a year, then the person is suffer with pneumonia that is very dangerous for that person. The laboratory test or the diagnostic test for the pneumonia is chest radiography and sputum examination and culture. So the test for pneumonia is chest radiography and sputum examination and culture. Now we can move to the pathophysiology of pneumonia. Microorganisms gain the access to the lower respiratory tracts by the three route. So the microorganism means the antigen. Antigen is the infected bacteria or viruses that infect the respiratory tracts. So this microorganism enter into the lower respiratory tracts by three routes. The first one is they may be enter as a aerosolized particle, like with air they can be enter into the respiratory tract during the breathing of the person. They may enter the lung via the blood stream, like blood transfer from heart to lung and lungs to the whole body. So through that time the infected microorganism or antigen can enter into the respiratory tracts through bloodstream. And the third one is aspiration of oropharyngeal content may occur, like those things we are eating daily basis, through that can microorganism or antigen can be enter in our body. Lung infection with viruses suppress the bacteria killing activity of the lungs. So the infection of the lung with viruses suppress means reduce the bacteria killing activity of lungs. So viruses with infection reduce the bacteria killing activity of the lungs by impairing alveolar macrophages function. So they will reduce the function of macrophages and reduce the killing activity of bacteria in the lungs, and also the mucociliary clearance. So mucociliary clearance also impairing by the lung infection, and thus setting the stage of secondary bronchial pneumonia. And this lung infection with viruses set the stage for secondary bronchial pneumonia. The most pathogen causing community acquired pneumonia in otherwise healthy adult is streptococcus pneumonia, up to 30%. So up to 30% healthy adult can be infected to the pneumonia through the pathogen called streptococcus pneumonia. And other commonly bacteria cause is Haemophilus influenza. And the another pathogen that causes pneumonia, that one is called Haemophilus influenza. And a typical pathogen and another pathogen that include pneumonia to the person, that pathogen is called Mycoplasma pneumonia. Then the classification of the pneumonia, there have mainly three type of pneumonia, like first one is community acquired pneumonia. Pneumonia develop in the patient with no contact to the medical facility. If the person suffer with fever or co-production, the person should take medicine. If the person did not taking medicine for lots of time, then the person can be suffer with the pneumonia. If the person like do not take medicine lots of time, even the person suffer with cough or fever, then this type of pneumonia can be taking place. The risk factor of this commonly acquired pneumonia is the person of the age of that person may be more than 65 years, and if the person suffer with diabetes mellitus, that which called in our general language sugar, and if the person smoking and alcohol taking, then the person can be suffer with this type of pneumonia. And the pulmonary disease mean respiratory tract containing any other disease. If the person having any liver disease, any liver damage, and the renal disease like urine secretion and the kidney stone, that type of person can also be suffer with community acquired pneumonia. And the second one is hospital acquired pneumonia. So the hospital acquired pneumonia is taking place. Pneumonia develop more than 48 hours after hospital administration. So hospital acquired pneumonia taking place in the person after the person admitted in the hospital more than 48 hours. There is very dangerous type of pneumonia. So the risk factor of this hospital acquired pneumonia is COPD, means chronic obstructive pulmonary disease. It is one type of disease. There the respiratory tract will be constriction and the bronchodilator will be needed to dilation of the respiratory tract. It is one of the most dangerous risk factor of the hospital acquired pneumonia. And or if the person having in coma, that means the person do not do any daily activity, like the person is only living and they cannot do any work or any other thing. And if the person administration of antacids is used for mainly like to reduce vomiting or nausea or the high gastric level. If the person take antacids like example aspirin and the proton pump inhibitor, the proton pump inhibitor also used to reduce the gastric level, the nausea and the vomiting. The one of the example of proton pump inhibitor is pantoprazole, rabeprazole, omeprazole. So this type of medicine should not take during if the time of the patient suffer with pneumonia. And also H2 antagonist. H2 antagonist is also used for reducing the level of gastric, the level of nausea, the level of vomiting. The example of H2 antagonist is formoterol. And if the person age is more than 60 years, then also the person suffer with hospital acquired pneumonia. And enter nutrition and nasogastric tube. If the person taking nutrition more, that the person is do not capable to taking, then also the person suffer with this type of pneumonia. Then we will move to the third type of pneumonia, that's called ventilator associated pneumonia. So this type of pneumonia generally occurs pneumonia developing after 48 hours of mechanical ventilation. So if the person is admitted in the hospital and in the ICU, or the mechanical ventilation also can giving to that person who more than 48 hours, then can be that person suffer with ventilated associated pneumonia. So the risk factor of the ventilation associated pneumonia is COPD, same like hospital acquired pneumonia, chronic obstructive pulmonary disease and coma. And the second risk factor is administration of antacids, proton pump inhibitor and the H2 antagonist. And if the person admitted in the hospital more than 5 days. So now we will discuss about the treatment of all type of respiratory tract infection. Here the treatment of the disease called pneumonia. The antibiotic class is penicillin, the name of the antibiotic, here the name of the brand name, here the dose for pediatrics like the children's kids, and here the dose for adults whose weight in kg 50 to 100 kg, like antibiotic ampicillin plus sulbactam, brand name is unazen, the dose for pediatrics is 150 to 200 mg per kg. So if the weight of the children is 5 kg, then we have to multiply 200 into 5. So like 100 1000 mg we have to give to that children in a whole day, and the dose for adult is 6 to 12 gram. Then the second antibiotic penicillin is amoxicillin and colobolonate. The brand name of the antibiotic is augmentin, and the dose for pediatrics is 45 to 100 mg. Then we have to calculate same like that, and we have to give that medicine in a day, and the dose for adult is 0.75 gram to 1 gram to the adult. And the another type of antibiotic for the pneumonia is extended spectrum cephalosporin. The first one is ceftriaxone. The brand name is Rocephin, and for the pediatric dose is 50 to 75 mg per kg, and for the adult is 1 to 2 gram. Then the second antibiotic is ceftriaxone. The brand name is clafuran. The dose for pediatric is 150 mg per kg, and for the adult is 2 to 12 gram. Then we will move to the another type of antibody for azalid, for pneumonia is azalid, like clarithromycin, brand name is Biaxin, and for the pediatric is 15 mg per kg, and for adult is 0.5 gram to 1 gram. Then the second one is erythromycin. The brand name of erythromycin is erythrocin. The dose for pediatrics is 30 to 50 gram, and for adult is 1 to 2 gram. Then the third one, azalid type of antibiotic for pneumonia is azithromycin. The brand name is Zythromax. For pediatrics, dose is 10 mg per kg, and for the adult, if the person takes 500 mg, then it will be for 1 day or 2 day, or if the person take 250 mg, then the dose will be increased for 2 to 5 days. Then the another type of antibody for antibiotic for pneumonia is fluoroquinolone. The first one is levofloxacin. The brand name is Levoquin, and for the pediatric dose is 8 to 20 mg per kg, and the for the adult is 720 mg. And the second one is ciprofloxacin. The brand name is Cipro, and for pediatric dose is 30 mg per kg, and for adult is 1.2 gram. Then we will move to the another type of antibiotic for pneumonia is tetracycline. The first one is doxycycline. The brand name is Monodox or Doxy 100. The dose for pediatrics is 2 to 5 mg per kg in a day, and for adult is 100 to 200 mg in a day. And the second one is tetracycline HCl. The brand name is also tetracycline HCl, and dose for pediatrics is 25 to 50 mg per kg, and for the adult is 1 to 2 gram. Now we will move to the treatment for the bronchitis. Here the name of antibiotic, brand name, use dose, adult dose per mg, and dose sequence dose day, means how many times should take the dose in a day. Like first antibiotic is ampicillin, brand name is also ampicillin. Dose for adult is 250 to 500 mg, and the dose should be taken 3 to 4 times in a day. The second one is amoxicillin. The brand name is also amoxicillin. Use adult dose is 50 to 875 mg, and dose should be taken in a day 2 to 3 times. Then the third antibiotic for bronchitis is ciprofloxacin. Here, as you see in the treatment of pneumonia, the brand name is Cipro, and should take dose is 500 to 750 mg and should be taken 2 times a day. For levofloxacin, the next antibiotic for treatment of bronchitis is levofloxacin. The brand name is Levoquin and dose is 500 mg to 750 mg. Take once in a day. Then next antibiotic is moxifloxacin. The brand name is Avelox and dose 400 mg. Takes once in a day. Then doxycycline. The brand name is Monodox. The dose is 100 mg, takes twice in a day. Then the next one is minocycline. The brand name is Minocin and the dose is 100 mg, takes twice in a day. Then the last antibiotic for the bronchitis is tetracycline HCl. The brand name is also tetracycline HCl and the dose will be taking 500 mg for 4 times a day. And the supplementary drug for treatment of bronchitis is azithromycin. The brand name is Zythromax and the dose will be 250 mg to 500 mg, takes once in a day. Then the another drugs is erythromycin. The brand name is erythrocin. Dose will be 500 mg, takes 4 times in a day. Then the last drugs is clarithromycin. The brand name is Biaxin, takes 250 mg to 500 mg in a day 2 times. Then we will move to the treatment of upper respiratory tract infection. The antibiotic and dose for the group A B. Hemolytic streptococcal pharyngitis. The preferred antibiotic is penicillin V and the brand name will be Pen V. The dose for the children is 250 mg 2 times twice daily orally and for adult 250 mg 4 times 500 mg. Duration will be for 10 days. Then the next antibiotic is penicillin G benzothine. The brand name is Bicillin LA and the dose will be less than 27 kg of weight people 0.6 million unit, more than 27 kg 1.2 million units. The duration will be 1 days. Then the another antibiotic is amoxicillin, brand name is amoxil and the dose will be 50 mg per kg once in a daily for dose for 10 days. Then the penicillin, allergen, cephalexin, ceftriaxone, azithromycin and clarithromycin all are for 10 days. Then we will move to another upper respiratory tract infection, that is antibiotic and dose for acute bacterial rhinitis in children. So the antibiotic and here the brand name, dose and the comment. For initial treatment of the rhinitis, the antibiotic will be used amoxicillin clavulanate. The brand name will be augmentin 45 mg per kg dose, taking orally 2 doses per day. And the again amoxicillin plus clavulanate augmentin 90 mg per kg orally 2 doses per day. Then the risk for antibiotic resistance, fail initial therapy. If the initial treatment is failed, then we have to give this treatment. The name of the antibiotic is amoxicillin plus clavulanate. The brand name is augmentin. Dose will be 90 mg per kg orally, 2 doses in a day. And the another antibiotic is levofloxacin. The brand name will be Levoquin and the dose is 10 mg to 20 mg per kg orally, take 12 hours to 24 hourly, and severe infection require hospitalization. If the treatment will not treated the children, then we have to admitted that children in hospital hospitalized, and we have to give those antibiotic in intravenous through injection like ampicillin and sulbactam, brand name Anazin, 200 to 400 mg per kg in intravenous every 6 hours. Means every 6 hours we have to give this antibiotic for 200 to 400 mg. Then ceftriaxone, brand name Rosevin, 50 mg per kg day, intravenous every 12 hour. Means after every 12 hour to 12 hour we have to give ceftriaxone. Then cephalosporin, clavulan, that is brand name, also have to give 100 to 200 mg per kg day intravenous through injection every 6 hours. And the last one is levofloxacin, the brand name is levoquin, 10 to 20 mg per kg in a day, and 4 times intravenous through 12 hours to 40 hourly. Then this antibiotic for acute bronchitis rhinitis for adult, the antibiotic name will be amoxicillin plus clavonate. Augmentin is a brand name. Dose will be 500 mg to 125 mg orally 3 times daily. Then amoxicillin plus carbonate, brand name is Augmentin, 2000 mg to 125 mg taking orally 2 times daily. Then doxycycline, 100 mg taking orally through mouth 2 times a day, and 200 mg taking orally through mouth once daily. Then risk for antibiotic resistance or fail in initial therapy. The antibiotic name is amoxicillin and carbonate. The brand name is Augmentin. Give the medicinal dose 2000 to 125 mg orally 2 times a day. And if the patient need to admitted in hospital, then we have to give intravenous antibiotic dose through. The first dose will be ampicillin and sulbactam, brand name is Anazen. We have to give 1.5 to 3 gram through intravenous every 6 hours frequently. Then levofloxacin, the brand name will be Levoquin. We have to give 500 mg. Moxifloxacin, the brand name is Abuflax. We have to give 400 mg orally once daily. And ceftriaxone, the brand name is Rosepin, 1 to 2 gram intravenous every 12 to 24 hours. And the last one is ceftriaxone. The brand name is Clafuran, 2 gram through intravenous every 4 to 6 hourly. We have to give. Thanks for the today's session.